Every year, millions of Americans rely on programs like SNAP and Medicaid to put food on the table and receive basic health care, but in 2025 proposed federal budget cuts threaten to slash over $1.1 trillion from these life-saving programs over the next decade. These cuts put tens of millions of people at risk of losing nutrition, health care, and essential support, potentially leaving 22 million families facing hunger and 10 million Americans without health coverage. The social safety net, including health care, nutrition assistance, unemployment benefits, housing support, and aid for children or people with disabilities, has historically cushioned Americans from poverty and hardship. Over 70 million Americans depend on Medicaid, and more than 40 million rely on SNAP, demonstrating how deeply these programs are woven into daily life. In 2025, the U.S. House passed a budget resolution proposing reductions of roughly $880 billion for Medicaid and nearly $230 billion for SNAP over 10 years, totaling over $1.1 trillion in cuts. These represent the largest reductions in U.S. history for these programs, threatening access to health care and basic nutrition for millions of families. SNAP, originally food stamps, helps low-income households buy essential groceries like milk, bread, and vegetables and serves as a lifeline for struggling Americans. Cuts to SNAP could reduce funding by 21%, potentially affecting 22.3 million families and eliminating an average of $146 per month in benefits, increasing food insecurity nationwide. Medicaid provides health insurance for low-income Americans, seniors, children, and people with disabilities, forming a crucial pillar of the U.S. healthcare system. Proposed Medicaid reductions of $880 billion over 10 years could leave 10 to 11 million Americans uninsured, and clinics in rural areas may close, removing basic healthcare access. Cutting these programs affects not only individuals but also state and national economies, potentially causing 1 million job losses and reducing state GDP by over $113 billion in 2026. Safety net programs function as economic engines, as reduced household spending impacts grocery stores, hospitals, small businesses, tax revenue, and public services. In healthcare alone, 500,000 jobs could be lost, while 78,000 food sector jobs might disappear, totaling over 1.2 million potential job losses by 2029. States like Texas could lose tens of thousands of jobs, weakening local economies and pushing more families into hardship. Behind these statistics are real people. A grandmother unable to afford insulin, a parent choosing between rent and groceries, and children missing essential medication. Clinics and hospitals serving large Medicaid populations may face financial strain or closure, leaving neighborhoods without emergency care and basic healthcare services. Losing SNAP benefits increases food insecurity and worsens health outcomes, leading to higher rates of chronic illness, mental health challenges, and hospital visits. Children affected by food insecurity face developmental delays, poor academic performance, and long-term health consequences that can persist into adulthood. Countries like Norway, Sweden, and Germany maintain stronger social safety nets, offering universal health care, generous family support, and nutrition assistance that reduce poverty and improve public health. Norway guarantees health care and nutrition for children regardless of family income. And Sweden's social welfare programs prevent families from falling into poverty, contrasting with U.S. reductions. Nearly 34 million children in the U.S. rely on SNAP, Medicaid, or both, making them particularly vulnerable to budget cuts, with marginalized communities at highest risk. Families already struggling with low wages, limited opportunities, or chronic health challenges may face deeper insecurity, impacting education, mental health, and lifetime earnings. Proponents of budget cuts argue they control federal spending, reduce deficits, and encourage economic growth through tighter eligibility rules and incentives for self-sufficiency. Critics argue that cutting essential support weakens society, increases inequality, undermines long-term economic growth, and harms the communities these programs sustain. Slashing safety net programs may increase preventable diseases, childhood food insecurity, and dependence on costly emergency services, ultimately raising long-term government expenses. Investments in public health, nutrition programs, and community support could reduce long-term costs, strengthen the economy, and improve quality of life, as demonstrated by countries with strong safety nets. Budget decisions are reshaping the lives of millions, affecting communities, economies, and families, as the social safety net exists to give every American the chance to thrive. Understanding both the numbers and the human stories behind these cuts is essential, because society is judged not by profit but by how it protects its most vulnerable citizens. Cuts to SNAP and Medicaid illustrate that policy decisions can have cascading effects on hunger, health, education, employment, and economic stability across the nation. Reduced funding threatens the nutritional security of children, the healthcare of seniors and people with disabilities, and the economic security of working families. Clinics and hospitals face closures from reduced reimbursements, especially in rural and low-income areas, further widening the gap in access to care. Economists warn that reduced support could increase long-term costs by driving up preventable illness, emergency care, and reliance on social services outside the safety net. Food insecurity caused by SNAP cuts correlates with higher rates of chronic disease, cognitive delays in children, and mental health challenges for adults. Loss of Medicaid coverage is linked to delayed treatments, skipped medications, higher mortality rates, and growing medical debt for affected families. International comparisons show that investing in social safety nets can reduce poverty, improve public health, and create stronger, more resilient economies. Norway's universal healthcare and nutrition programs ensure that every child has access to basic needs, showing how policy can prevent inequality rather than exacerbate it. Sweden's comprehensive social welfare system demonstrates that strong government support can coexist with economic growth and high standards of living. The U.S., in contrast, is moving toward reducing support for its most vulnerable while offering tax cuts for wealthy individuals and corporations, highlighting a growing disparity. Children, elderly, and disabled populations are the hardest hit by budget reductions, experiencing the greatest immediate and long-term negative effects. Families in low-income communities may face a cascade of challenges, including poor nutrition, lack of health care, missed educational opportunities, and lifelong economic disadvantage. Proponents of cuts claim that limiting government support incentivizes employment and self-reliance, framing budget reductions as fiscal responsibility. Opponents warn that these policies erode social cohesion, exacerbate inequality, and create avoidable human suffering across the nation. Economic analyses show that cutting SNAP and Medicaid will reduce household spending, weaken local businesses, and diminish state revenue, compounding the problem. Job losses in healthcare and food-related sectors could surpass 1 million by 2029, affecting millions of families who rely on these industries for employment. Human stories reveal the real impact: grandparents skipping medications, parents choosing between rent and groceries, and children going hungry or missing critical healthcare. Clinics and hospitals closing due to funding cuts create health deserts, particularly in rural or underserved urban areas, increasing risks for entire communities. Long-term consequences include higher rates of preventable disease, mental health problems, childhood developmental delays, and diminished educational outcomes. Failure to maintain a robust safety net can increase reliance on costly emergency care, driving up federal and state expenditures instead of reducing them. Investing in public health, nutrition, and community support can provide long-term benefits, strengthen economies, and improve quality of life for millions of Americans. Countries with strong safety nets enjoy lower poverty rates, healthier populations, and more stable economies, offering models for U.S. policy improvement. Every policy decision about funding SNAP or Medicaid has cascading effects on nutrition, healthcare, jobs, and economic stability across the nation. These budget cuts are not abstract numbers. They represent real people, real families, and real lives being disrupted. Social safety nets serve as both a lifeline for vulnerable populations and an engine for local and national economic stability. The choices made today about funding and support will shape the health, well-being, and economic future of millions of Americans. Understanding these policies requires recognizing both the numerical and human dimensions of the cuts, from statistics to personal stories. The stakes are high. Hunger, illness, job loss, and poverty are all potential consequences of shrinking the safety net. Strong investments in public health, nutrition, and family support could prevent these negative outcomes, creating a more resilient and equitable society. Children, seniors, and people with disabilities are the most vulnerable and need robust support to ensure long-term health and opportunity. Ultimately, the effectiveness of social safety nets reflects society's values. determining whether Americans protect their most vulnerable or leave them exposed. Cuts to the safety net programs are more than fiscal decisions, they are choices that define the character, health, and future of the nation.